first patient, almost 3 years old, had a near-drowning episode 3 months previously and was semi-apolic. According to the pediatric neurologist, his outlook was 0.
Eric was born August 2nd of '93. He was a perfectly normal child until he had a head trauma before falling into a pool, which caused the near drowning. After the near drowning, they told us that he has certain parts of his brain that were dead and has atrophy in the brain. And we heard about the hyperbaric chamber, so we are coming here to try and get some oxygen back into his brain.
And today Eric is going to be going for a repeat SPECT scan.
The SPECT scan, again, which is a functional image of the brain, showed dramatic improvement in cortical function after hyperbaric oxygenation. It has filled in with areas that were not receiving enough blood or oxygen, and the patient is very much better and has really had a new life.
You're playing with your feet there?
The next case was a very attractive 14-year-old white female with diabetes. She developed a severe bout of hypoglycemia with seizure disorder producing marked brain injury. She had become almost total care, as can be seen in the video clips.
This is how she was about 2 weeks after her injury. They kept her in a floor bed so she wouldn't hurt herself during her agitation.
Go ahead, Amber. This is your chance to show out.
This is the first time they tried to stand her up. It took 3 people to help her stand up. She had a nose tube in the time where they fed her through her nose. Here she is during therapy. You can see the pain on her face as they try to help her.
The SPECT scan showed minimal cortical function, but after hyperbaric oxygenation, there was a marked filling in of the cortex, and although still patchy, there was about a 70 to 80% improvement in the scan, but the patient now became self-sufficient and is able to attend school.
Okay, she's walking really good. She's got the smiles. She's got the smiles, that's for sure. Very good. Very good. Look at that smile.
The next patient arrived in a wheelchair. He had had a massive stroke at birth. He was unable to use his left side at all. Cognitively, motor-wise, he was almost totally disabled.
Well, David is 3.5 years old. He is genetically normal, but the chromosome is wrong. David had what's called a vascular accident at birth. He was a product of a traumatic birth. He tore the left middle cerebral artery in his brain. The result is a very large infarction in the left hemisphere. And as a result, he developed severe seizures. We were able to get those under control, but what we're left with is a severe and multiply impaired child. He functions at about a 10 to 15 month range.
The SPECT scan showed almost a total lack of blood going to the left mid-cerebral artery, which of course would involve his right side. But after hyperbaric oxygen, there was a dramatic improvement in the cortical flow, which paralleled the patient's condition. As you can see now, he runs all over the place.
Why don't you run, Dave? Where are we going? No, whatever goes at, where are you going? Look at Ian.
This little lad had severe cerebral palsy due to a birth defect and a lack of oxygen. He had severe spasticity, scissors-like gait, the mentality of a 2-year-old, and was almost total care.
He has like 10 words of speech, and he gets around by crawling on his hands and knees. And His understanding is like a 2-year-old. It's a 3-year-old level. But he does comprehend to all his basic needs.
The SPECT scan initially showed multiple patchy areas of lack of oxygenation and blood flow, but after the hyperbaric oxygen treatments, it became very evident that the perfusion of the brain and the use of oxygenation improved substantially, and again, this was clinical parallel. This little fella, again, cognitively, motor-wise, fine motor, has improved in every way.
All right, Jason. Okay, he's going to go around the corner that way.
The tragedy of this beautiful little girl is that she was taken as an emergency after her head injury to a hospital that had a hyperbaric oxygen chamber. They would not treat her. They waited to see what would happen.
At this time, she has some mobility in her legs. Norms recognizes individuals she knows and is able to smile and laugh to some extent. She's not able to talk at this point. Still has spasticity in her right arm.